rewrites what pain even means. These are reconstructions based on publicly reported cases and medical case reports. Names are changed. Details are stitched together for storytelling. But the fear is real because it happened. Turn the lights down. Put your headphones on. And remember, sometimes the scariest place isn't a haunted house. It's a place that's supposed to save you. He'd been awake since 4:30 a.m., the way you get when you're told not to eat and your mind won't stop chewing on fear instead. The hospital room smelled like disinfectant and old coffee, the kind that sits on a warmer too long and turns bitter, like it's already given up. Marcus kept staring at his right foot. It didn't look like a foot anymore. Not really. It looked like a warning. Diabetes had been chewing on him for years, silently at first, then loudly, then violently. The skin darkened. The circulation failed. A wound opened and didn't close. A tiny injury became a tunnel that went deeper every week. The surgeon explained it with a calm voice that felt too clean for what he was saying. "We have to amputate. It's the only way to prevent the infection from traveling." Marcus nodded, because nodding was easier than imagining the alternative. He signed forms he barely read. He let people stick bands around his wrist, check his vitals, draw lines on clipboards that decided what would happen to his body. A nurse came in around 7. She was kind. She had tired eyes and a voice that tried to sound like daylight. "Okay, Marcus, we're going to take care of that right foot today." "Right," he said quickly, grateful she said it first. "The right one." She smiled like she heard that sentence 100 times a day, like it was routine. But he still looked down until she left, studying his legs as if he could memorize them, like a kid counting fingers to make sure they're still there. When transport arrived, the hallways blurred into fluorescent stripes. A gurney ride does something to your brain. It makes you feel like luggage, like a thing being moved, not a person being saved. In pre-op, it got colder. The air had a bite to it. A tech adjusted something near his arm. A blood pressure cuff squeezed, released, squeezed again. An anxious little machine trying to remind him he was still alive. A man in scrubs leaned over him. "Morning. We're going to get you comfortable." Marcus tried to speak, but his tongue felt heavy. He didn't want to sound paranoid, but the fear was crawling up his throat anyway. "Right foot," he said. "It's the right foot." The man nodded without looking up. "Mm-hmm." A second person came in. Another clipboard. Another check mark. Then the anesthesia started. Sweet chemical drift that pulled the room sideways. Marcus fought it harder than he expected. Something in him didn't want to go under, didn't want to surrender control. He heard voices like they were down a long tunnel. "Here we go." Pressure's dropping a bit. "Tourniquet. Ready?" Tourniquet. That word is supposed to be neutral in a hospital. It wasn't neutral in Marcus's head. It sounded like a belt being tightened around a decision that couldn't be undone. He tried to lift his head, tried to ask one more time, "Right foot, right foot, right foot," like a prayer. But the world folded, and the last thing he saw was a ceiling tile with a small brown stain shaped like a bird. He woke up wrong. That's the only way to describe it. When you wake from surgery, there's a groggy softness to the first moment. A fog. A confusion that still has hope inside it. But Marcus's first moment was a straight line of panic. Because something was missing that wasn't supposed to be missing. He didn't feel his left leg at first. Then he did. Not pain, not exactly. More like a huge empty throb. A sensation of absence so loud it screamed. He tried to lift his head and look down. The blanket rose, but it didn't cover what it should have covered. He saw bandages. Thick, clean, wrapped around a stump that used to be his left leg. His mouth opened and no sound came out at first. A nurse leaned in. Hey, don't move too fast." Marcus stared at her, eyes wide, breathing too quick. My foot," he whispered. She smiled like she was helping him remember something he'd forgotten. "It's okay. Surgery's done." He shook his head, a tiny movement that turned into a violent one. No, that's not." He pointed, trembling. That's the wrong leg. The nurse froze. Not fully, just enough that Marcus saw the shift, the microsecond where her body forgot how to pretend. She looked down, looked up. Her face changed color like someone turned down the lights. She stepped out of the room without saying anything, and Marcus heard the sound of her shoes hitting tile like a countdown. 2 minutes later, the room filled with people who suddenly couldn't meet his eyes. A doctor came in, older, tight jaw, hands that looked too steady for what he was about to say. Marcus's voice cracked. That's my left leg. The doctor swallowed. Mr. Marcus, there was a surgical error. Marcus tried to sit up, but pain rolled through him like a wave and shoved him back down. Error, he repeated. You cut off my leg and you're calling it an error? The doctor opened his mouth, closed it, opened it again. We amputated the incorrect limb. Marcus stared at him with a blankness that wasn't calm. It was the mind refusing to accept what the ears were hearing. Then the rage arrived. It came fast, boiling up from someplace primal. Marcus started shouting, asking who did it, asking why nobody checked, asking how a room full of trained professionals could look at a human being and remove the wrong part. The doctor's face tightened. We have to talk about next steps. Next steps? Marcus laughed, a broken, disbelieving sound. I came in with one bad foot. Now I have one bad foot and no good leg. He looked down again, as if staring hard enough could reverse reality. The right foot, the one that was supposed to go, was still there beneath the blanket, quietly rotting like a bomb that hadn't been defused. A woman in a blazer appeared later. Risk management, patient relations, whatever title meant, I'm here to keep this from exploding. She spoke gently, like she was soothing a child. Marcus didn't want gentle. Marcus wanted time travel. In the hours that followed, he learned the horrifying math of it. They had cut so far into the wrong leg that they couldn't fix it. They had destroyed healthy tissue that could not be restored. And now, because the original problem still existed, they would need to amputate the correct leg too. 2 amputations, one necessary, one unforgivable. He remembered saying right foot like a mantra. He remembered people nodding, and it hit him. Nodding isn't listening. That night, he didn't sleep. He lay in a hospital bed and stared at the ceiling, listening to monitors beep like in different metronomes. Every time someone walked past his door, he flinched, because footsteps now meant people who could take something from you and call it a mistake. When the surgeon returned to talk again, Marcus didn't shout this time. He asked one question, quiet, exhausted, terrifyingly simple. How did no one notice? The surgeon's answer was technical. Process talk, communication breakdown, charting, no marked site, a chain of assumptions. Marcus listened, then whispered, So, nobody knew my body. Nobody claimed it. Nobody protected it. And that was the real horror. Not the saw, not the blood, not the bandages. The horror was that a human being had become paperwork, and paperwork had won.
Diane didn't feel the sponge, not at first. That's what made it terrifying, how the body can carry a foreign object like a secret, quietly, for weeks, until it decides it's had enough. Her surgery was supposed to be straightforward, the kind of procedure doctors describe with words like routine and uneventful, as if saying them out loud makes the universe behave. She went under anesthesia, holding her husband's hand. She woke up with the tired, bruised soreness everyone says is normal. For 3 days, she did what they told her. Walk a little, rest a lot, drink water, take meds, watch for fever, call if something feels wrong. She kept waiting for the getting better part to kick in. But healing didn't arrive. Something else did. It started as pressure, a heaviness under the incision, like a fist pressing from the inside. Then nausea, then the kind of fatigue that didn't make sense. Diane would stand up and feel her vision dim, like her body was rationing electricity. When she called the office, they told her recovery can take time. It's probably inflammation, the nurse said. Inflammation, a word that sounds harmless until it's eating you alive. The fourth night, Diane woke up drenched in sweat, heart racing. Her husband, Mark, touched her forehead. "Babe, you're burning up." She tried to speak, but a cramp twisted her abdomen and stole her breath. She curled sideways, holding her stomach as if she could physically hold herself together. The ER waiting room was packed. People coughing, kids crying, fluorescent lights that made everyone look gray. Diane sat bent forward in a wheelchair, trembling. By the time they got her into a room, her blood pressure was dropping. A young doctor asked questions fast: pain scale, symptoms, timeline, surgery type. Then Diane vomited, sudden, violent, and her husband watched the color drain from her face. They ran tests, blood work, imaging, fluids, antibiotics. When the CT scan came back, the doctor's expression changed. It wasn't panic. It was that controlled fear professionals get when they're about to say something that has consequences. "There's something in your abdomen," he said slowly. Diane blinked. "Something?" He turned the monitor so they could see the image, an internal landscape of shadows and grays. Then he pointed, a shape, unmistakably not part of her. Diane stared at it like it was a bad joke. Mark said the word first because his brain couldn't find anything else. "Is that a sponge?" The doctor didn't answer immediately. He swallowed, then said, "It appears consistent with a retained surgical item." Retained, like it had chosen to stay. Diane's mouth went dry. Her hands shook. "A sponge?" she repeated. "From my surgery?" The doctor nodded once. "We need to take you back in." And that's when Diane started crying. Not loud, not dramatic, just silent tears that slid down her face in a line of disbelief. Because the place that cut her open left something inside her, then closed her back up and sent her home. In the operating room the second time, the fear felt different. Before, she'd been scared of surgery. Now she was scared of people. A nurse squeezed her hand. "We're going to fix this." Diane wanted to believe her, but her body remembered betrayal. She went under, and when she woke, her throat was raw from the tube and her abdomen felt like it had been hit with a truck. Mark was there, eyes red. He tried to smile. "They got it," he said. Diane whispered, "How?" He hesitated. It had caused an abscess. Abscess, another ugly word that lives under the skin of polite conversation. Over the next 48 hours, Diane got worse, not better. Her fever spiked. Her skin turned clammy. Her heart raced like it was trying to outrun something inside her. Nurses hung more antibiotics. Doctors spoke in low voices outside the door. Mark started counting the beeps of the monitor because focusing on numbers was easier than focusing on the truth. Then one morning, a doctor sat down and didn't stand up again. That was how Mark knew. "We're worried about sepsis," the doctor said. Mark stared at him. "But you removed it." The doctor nodded. "Yes, but infection can spread rapidly. Her body is in shock." Shock. Like the body has realized what happened and is reacting with horror. Diane drifted in and out of consciousness. In one lucid moment, she gripped Mark's hand hard enough to leave nail marks. "If I die," she whispered, "tell them they don't get to call this a complication." Mark swallowed. "You're not going to die." Diane stared at him, eyes glassy but clear. "They left it in me, Mark." She coughed, and it sounded wet. "They left it in me like I was nothing." A few hours later, alarms screamed. Nurses flooded the room, hands on her chest, oxygen mask, the rapid language of emergency, BPs dropping. "Push pressors. Call ICU, now." Mark was shoved into the hall. He watched through a small window as strangers fought for his wife's life, and he realized the cruelest part. The sponge didn't just steal her health, it stole her dignity. Because she had done everything right, she had trusted, she had complied, she had waited. And the thing that killed her wasn't a disease. It was a forgotten object.
It happened fast, too fast for anyone to stop it once it started. A small operating room. a spinal tray. The usual choreography: labels, gloves, syringes lined up like tools in a ritual. Jasmine was awake because spinal anesthesia often means you're awake. You feel pressure, tugging, but no pain. That was the promise. The anesthetist spoke calmly. Small pinch. Jasmine felt a sting in her back. Then warmth, like liquid spreading. For 2 seconds, everything was normal. Then Jasmine arched. Her hands clutched the sides of the bed like she was falling through it. Her eyes snapped wide, and her mouth opened in a scream that didn't sound human. "My back!" Her legs kicked, her body convulsed. "Seizure!" someone shouted. The room exploded into motion. Monitors shrieked. A nurse grabbed her shoulders to keep her from slamming her head. Another tried to pin her arms gently, desperately. Jasmine's scream turned into a guttural sound as if her nervous system had been set on fire. Because, later, they would learn. The wrong medication had entered the space near her spinal cord. A catastrophic root error. A medication meant for IV use, confused with a local anesthetic syringe in the spinal setup. A risk the FDA has warned about because it keeps happening. U.S. Food and Drug Administration, and when it goes into the spine, the body reacts like it's been attacked from the inside. Jasmine begged for them to stop it, even though there was nothing to stop, only damage unfolding. "Help me, please!" Then her words collapsed into choking gasps. Someone forced oxygen onto her face. "Get her under, now." The anesthetist's hands shook as he pushed sedatives. Another doctor called for intubation. Jasmine's eyes rolled back, and for a moment she looked like a person drowning in air. And then darkness. Not the relief kind, the dangerous kind. Her husband, Eli, got the first update in a hallway, a doctor who wouldn't make eye contact, a nurse who kept swallowing, a sentence that sounded like it was being dragged out of someone. "There was a medication error." Eli frowned. "What does that mean?" The doctor hesitated. "A drug was administered by the wrong route." Eli's stomach dropped. "Is she okay?" The doctor opened his mouth, then closed it again as if the truth tasted bad. "She had severe neurologic symptoms immediately. We're stabilizing her." Eli stared, trying to translate the words into something understandable. "Is she awake?" The doctor shook his head. "She's in intensive care." Eli pushed past them and saw her through ICU glass. His wife, still, pale, tubes everywhere, machines breathing for her, pumps feeding drugs into her veins like a desperate attempt to negotiate with her nervous system. A nurse explained in a low voice. "Seizures, arrhythmias, uncontrolled blood pressure swings, the body fighting itself." Eli felt like he'd stepped into an alternate reality where hospitals weren't safe, where one swap of a syringe could turn a routine plan into a catastrophe. He watched her chest rise and fall with the ventilator and thought, she was awake 5 minutes ago. She was talking. She was alive in the normal way. Now she looked like a photograph. Later, he learned the detail that haunted him most. It wasn't just that the wrong medication was used. It was how it happened. A similar-looking vial, similar syringes, a tray that didn't physically separate dangerous lookalikes, a system that relied on humans never blinking, never misreading, never rushing. One tiny human slip inside a high-speed environment, and the nervous system pays the price. Eli sat beside her bed and held her hand while the ICU hummed. He told her everything out loud because silence felt like giving up. He told her about the day they met, about the stupid movie they both secretly loved, about the vacation they never took, and the whole time a monitor beeped steadily, indifferent. At 3:12 a.m., alarms erupted again. A nurse shoved him back. Doctors flooded in. Eli stood against the wall, watching them compress her chest, push meds, call numbers like they were trying to bargain with death. A doctor shouted, "We've got VF, shock!" Eli's knees nearly buckled. They shocked her. Once, twice. Then a different kind of quiet arrived. The quiet where people stop moving fast and start moving slow. The doctor turned to Eli with exhausted eyes. "I'm sorry." Eli didn't understand at first, not truly. Then he saw it on the monitor, a flat line, and he realized the real horror wasn't the seizure, or the ICU, or the machines. It was the fact that the mistake was preventable, and still, it happened.
People think anesthesia is like a light switch, on, then off. But sometimes it's more like being buried alive. Caleb remembers the smell first, not the hospital smell, the sharp, clean one, but the warm, metallic smell that hits the back of your throat when blood meets air. He'd gone in for a procedure that wasn't supposed to be a big deal. That was how they sold it. Quick, common, you'll be asleep. The mask came down. The room softened. Caleb felt himself sinking. Then, nothing. Then, everything. He couldn't open his eyes. He couldn't move his arms. He couldn't lift a finger. But he could hear. A voice. Scalpel. Another voice. Suction. Caleb's heart slammed against his ribs. He tried to inhale, felt the ventilator forcing air. Panic rose like fire. "I'm awake." He tried to scream. Nothing came out. Then pain arrived. Not pressure, not discomfort. Pain, white hot, slicing, impossible pain that tore through him while his body stayed perfectly still, locked in chemical paralysis. Caleb's mind shattered into fragments. "Stop. Please stop. I can feel it." He tried to send the message through the only part of him that could still move, his thoughts, like maybe thoughts could become signals. Tears formed under his closed eyelids, trapped there. A voice said, "He's moving a lot." Another voice laughed softly, like it was a joke. Caleb's entire soul screamed. When he finally woke for real, he bolted upright, choking, ripping at the oxygen. Nurses rushed in. "Sir, calm down." Caleb's voice came out broken. "I was awake." A nurse froze. "No, you weren't." Caleb stared at her with eyes that had seen hell. "I was awake." He described it. Sounds, words, pain. Details patients don't invent easily. The nurse's face shifted into something cautious. She stepped out. A doctor came later, too calm, too rehearsed. "Sometimes people have dreams." Caleb laughed once, sharp and humorless. "That wasn't a dream. I felt you cut me." The doctor's jaw flexed. "We monitor anesthesia carefully." Caleb's hands shook. "Then your monitors are lying." The trauma didn't end when he left the hospital. That was the trick. The body healed faster than the brain. At night, Caleb would jolt awake, drenched in sweat, convinced he couldn't move. His wife would find him sitting upright, staring at nothing, gasping. He stopped going to checkups, stopped trusting prescriptions, stopped sleeping. Because the worst part of being awake under anesthesia isn't the pain. It's the helplessness. It's learning that consciousness can exist without control. And once your brain learns that, it never forgets. Months later, a therapist used the words post-traumatic stress like they were a label you could stick on the experience and file it away. But Caleb knew the truth. He didn't just survive surgery. He survived being trapped inside his own body, listening, feeling, begging, while everyone around him believed he was unconscious. And that's a kind of horror that follows you home. If these stories messed with your head, good. They're supposed to, because they're not ghost stories. These are human system failures that real people lived through. Again, these were reconstructed from publicly documented cases, with identifying details changed. If you want more true event-inspired medical horror, wrong site surgery, missed sepsis, fatal mix-ups, ER chaos, hit like, subscribe, and share this with someone who can handle the dark stuff. And remember, when the beeping stops, sometimes the nightmare starts.